Hi, Dr. Henry. A new poll out today suggests some varying views on the flu shot this year, causing some health officials, that I've spoken with to voice concern about what they're calling a twindemic, I guess, which is when flu season collides with the ongoing pandemic. It found that essentially 1 in 6 people polled said they feel that because they have not yet contracted COVID-19, they aren't really worried about getting the flu. I'm curious on what your thoughts are when it comes to British Columbians who are questioning whether they should get the flu shot or not this year.
Yeah, so there's a number of reasons why it's important for us to be aware of influenza this year more than ever. And that's because even though we know we may be healthy, we may not feel we're at risk, we can pass it on to others who are at risk as well. And the flu shot is effective and safe. And we know that children and the elderly are more likely to have severe illness from influenza, and so they need to have priority for being protected. But we also know that that influenza can spread very rapidly, and it can lead to, every year we see it lead to people needing hospitalization and care, whether it's in the children's hospital or adults. So this is the year where we all need to do what we can to keep influenza as low as possible in our communities so that we're protecting our healthcare system, but also so we're able to tell the difference between COVID and influenza, and it makes it easier for us to know if somebody has COVID as well, and we can manage both of these epidemics at the same time. We know that influenza will be coming, and we know that we can take measures to protect ourselves and our families by being immunized.
As we head into flu season and with students back at school, can you clarify how important it is to sanitize surfaces? Because there's been some discussion and debate on an international level about transmission of the virus from surfaces. So I was wondering, what is your evaluation of the risk level of that transmission?
I know it is challenging. You know, we talked about this earlier on, and then we learn more about the virus and where it lives and where it doesn't live so much. And then I know there was a recent laboratory study where they showed that they could keep the virus alive in certain surfaces in a laboratory setting for long periods of time. But we're not seeing that being a major source of transmission in most community settings. It can be an issue, particularly in healthcare, where we have a lot of people with a lot of virus. But I think what we are seeing in community settings is that, especially outdoors, the virus does not live very long. And indoors, really important is routine cleaning of those high-touch areas and making sure that we're cleaning our hands and not touching our face. This virus doesn't get transmitted through the skin. So if we're touching something or a surface that has virus on it, it can get into our system if we rub our eyes or we put our hands that are contaminated around our nose or mouth. So those are the things that we need to pay attention to, and that's why we talk about cleaning your hands regularly, making sure we're careful about not touching our face, and cleaning our surfaces routinely. So those are things that are good advice for us all the time, and will work against this virus as well.